Thank you for joining me today. We have Dr. Vladimir Sinkov. He's a spinal surgeon at Nevada Orthopedics and Spine Center. Can you tell me a little bit more about your work, how you got into orthopedics, and specifically orthopedics of the spine?
Fairly typical course for a spine surgeon, I would say. I wanted to become some type of a doctor since I was a kid. Both my parents were physicians back in Russia. I came to the United States when I was 16 as a high school exchange student, managed to stay here for college, then got into medical school. In medical school, initially, I thought I'm going to be an emergency doctor since I volunteered at college a lot in the emergency room. As we were doing more anatomy lessons and surgery rotations, I started liking more and more, so I decided I'm going to be a surgeon. Then I was already interested in carpentry just as a hobby as a kid, so orthopedics kind of seemed to be the fairly logical next step. And as I was training in orthopedics, going through the residency, I realized that spine surgery was my most favorite part of that for various reasons. One of them is it is gratifying. You get to help people, just like everywhere else in medicine in general. But spine surgery, I would say, is not as developed as a lot of fields. There's still a lot of improvements that can be done. So it made me feel that it's something I can continue to improve on throughout the career, not something I'll do repeatedly over and over because it's already perfected. And it was fairly difficult, fairly challenging, and I like a challenge. I like being able to conquer a challenge.
Wow, so you said you were interested in carpentry originally, and that's so interesting. So what's your favorite part about orthopedics? Like your most favorite?
Outcomes. My favorite is when I do a surgery on the patient and they are better than they were before surgery. That's the whole reason I'm doing that, and seeing them function better, get back to work, get back to their function. It kind of gives me meaning to what I do.
Wow. What's your least favorite part about orthopedics?
When things don't go well. Unfortunately, they sometimes do. I wish we were all 100% perfect and successful in everything we do for patients. When there's a bad outcome, obviously it makes everybody feel bad, and the patient, and of course the surgeon as well.
I mean, I can't even imagine because it's such a serious procedure, you know. What about, okay, so when it comes to like demographics that you work with, you know, you have different ethnicities, you have different kind of age groups. What would you say is the most difficult to connect with?
I wouldn't say there's a age-wise demographics that's more difficult to connect with. People come in all flavors, so to speak, of in terms of how easy it is to connect with them. Obviously, the least receptive a patient to begin with, the more mistrustful they are to a physician, the harder it is to connect with them, the harder it is to get them to follow what you want them to do to get them better. But I wouldn't say that's really age dependent. I've had great compliant patients and poorly compliant patients in all age
groups. Okay. Yeah, I hear a lot about like millennials being, you know, the generation that's like either they're your favorite or they're tough to connect with.
A lot of millennials, so to speak, haven't gotten to the age group where they would commonly see a spine surgeon for a surgery. On the other hand, when I do see them, they are usually fairly well educated, better educated than other age groups might be.
Okay.
It may be good because it keeps us a step of educating them the basics of the spine, but it may be bad if they're misinformed and they trusted Dr. Google too much. And I then
Dr. Google
convincing them that just because this was on Google and somebody told them that might not necessarily be true. So, more difficult. They come once again in both flavors.
So Dan Kennedy is a strategic marketing coach, and he says that entrepreneurs in all businesses only struggle with 4 things, and it's either money, time, people, or passion. And so which would you say that you've struggled with the most, and then which would you say orthopedics kind of in general seems to struggle with the most?
It's a little bit of everything. Orthopedics and medicine in general is a little bit different than a lot of businesses because it is so regulated. While it is theoretically a free market medicine in the United States, in reality it is not. A lot of things that I do for work other than treating patients are not under my control. I'm sure you've heard it from many physicians. If I only have to spend my time at work treating patients, I'll be at least twice as efficient as I am right now. A lot of things we do are mandated things that don't really help anybody, but have to be done because of regulations. So that really makes medicine as an industry, much tougher. You can say that regulation usually equals money, so probably be the money thing. In terms of good patient outcomes, the biggest trouble is probably communication and trust, which is both
Mm,
professional between physicians, other health professionals, as well as all the health professionals and patients. I would say biggest problem that gets people in trouble and causes bad outcomes that shouldn't have been bad is probably poor communication and poor trust. If you think about spine surgery or orthopedic surgery in general, most patients come in scared, anxious, and in pain. That's
right.
the whole point. They're coming to an orthopedic surgeon. They're not coming for a flu shot or diabetes check. So trying to reassure them, calm them down that they're in a safe place is kind of where you start building trust. And until you do that, everything else you do doesn't really matter. They will not hear anything about their need for spine surgery, their need for this and that treatment until they actually start trusting you. So you have to alleviate their fears and anxiety. I do spend 20, 30 minutes easily with a patient, but more patients are more likely to choose me as a surgeon as opposed to somebody else who walked in, spent 5 minutes, showed them one x-ray and walked away. And I hear that over and over from my patients. So it works.
Right.
Trying to find that balance is hard. I typically run late in clinic because I spend too much time with patients because of building trust and everything I've valued so much, and which has helped me. I am a living proof that it does work spending time with patients. I'd rather apologize to the next patient for running late. They always get grumpy when I walk into the room because I'm an hour late, but when they walk out, they're smiling because I gave them the same amount of time. Logistically, if you say other than dealing with the regulations of insurance companies, the government, the hardest thing is to spend enough time with the patient, but yet see enough patients in a day to make it economically feasible because they are inversely proportional.
When you sit down and get to know a patient, does it ever become like more of like a friendship? Like, is it ever that level of kind of camaraderie, or is it?
I try not to. It's still, yeah, obviously, once you operate on somebody, you know them more intimately than almost anybody else ever. You've been inside their body, not in a weird way, but it
Mhm.
is a huge level of trust to let somebody cut on you. So you end up being on some level friends. I try to kind of have a little bit of a barrier and never truly become friends because then does become a conflict of a doctor-patient relationship should always
Mhm.
be professional doctor-patient. Once they get into friendship and they're like, hey, can you help me out? I just need 10 more oxycodones to get me through. I don't never want to get into that situation because that gets everybody in trouble. So yes, we always become somewhat friendly, especially when somebody operates on, but I always try and keep a limit. They don't know my phone
Yeah.
number. They don't have my email. If they have an email question, I tell them to contact my assistant. So there's always somebody in between, almost on purpose to kind of keep that little border and not become
Okay.
total buddies because that will become counterproductive on both sides. Because
Gotcha.
then, the same reason most doctors would not operate on their family. I think I will do the best job in the world operating on my own wife. Of course, I care about her more than anybody else, but I will never operate on her because it will be extremely difficult for me to stay objective if something goes wrong in the operating room. I'll get emotional. That's the last thing you want to
Mm,
do when you're operating on somebody. So you have to have a little bit of that border in order to be able to objectively do your job.
okay.
So,
That seems to be common, because because of all the confines of what it takes to get a person on a table in an operating room, people you're hiring, and just everything. You kind of miss out sometimes on that human to human connection. So
mhm.
so then outside of work, outside of your practice, what would you say? What would your family and friends describe you like?
I'm not frequently outside of my practice, unfortunately. I do work hours, but outgoing, fun-loving. I spend most of my free time with my family. We, do all kinds of things. We go outside and do a lot of outdoor activities. Stay inside at night, watch a movie, basic stuff, family stuff.
Family stuff. What are you most passionate about?
My family and my work, probably those two things. Are trying to
Mm,
keep them in balance.
the work-life balance. Would you say that it's that work-life balance that gets you out of bed in the morning?
Yeah, it's both. I go to work to provide for my family. I go to work to get my patients to be better, and I get satisfaction from doing what I do. And of course, if
That's
I'm
awesome.
getting out of bed on weekend, then it's something fun we're doing with the family.
So what's your long-term goal? Like, where do you see yourself? I mean, you're successful, a spine surgeon, you have a family. Where do you see yourself, in 20 years? What's a successful life?
Probably at 20 years from now, probably getting close to retiring. They'll get to spend more time with my family, more time with my wife. Until then, just doing what I do is, I can't really have any complaints about it. I wouldn't have done it any other way. I'm very happy with my work.
That's awesome. So how can viewers find you? Are you on social media?
I am on Facebook. I have managed to create a professional Facebook page, Dr. Vladimir Sinkov, and on LinkedIn. So I'm trying to get into the social media. Don't have much time to be on it. It is pretty time.
Awesome. Awesome. Well, thank you so much for taking the time to do this interview with me.
Thank you for having me.